subscribe now and press the bell icon. Never miss an update.
Hello and welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Anyapu Deepak, who is an experienced orthopedic surgeon equipped with a robust educational background, extensive hands-on experience, and a commitment to continuous learning and improvement. He holds an MBBS degree, which is from Guntur Medical College. He received his postgraduation from, which is an MS degree, and Master of Surgery in Orthopaedics from Rangaraya Medical College, and a fellowship in joint replacement from the Srikara Hospitals. He is currently working as a consultant orthopedic surgeon at the Mamata Multi-specialty Hospital in Andhra Pradesh. Welcome to Health Live at Seniors today, Dr. Deepak. How have you been?
Thank you, sir. Thank you for having me in this webinar. And I'm very pleased to today is a very good topic which you have chosen because
the topic. Dr. Deepak, the topic that we have chosen for you is joint replacement demystified and understanding your options and making informed decisions. And this is not the first time that we've done joint replacement, but what we have felt is that despite all the time that we've done sessions, there are still a whole lot of people who have doubts on joint replacement, and it would be good to demystify them. So over to you, doctor, for your presentation, and those of you who have questions, as always, please put them in the Q&A tab and I will take them immediately after doctor session. Over to you, doctor.
So good evening, one and all. I'm Dr. Deepak. I'm a joint replacement surgeon working in Mamata Multi-specialty Hospital in Andhra Pradesh. So today I'm very glad you have invited me for this excellent talk in this webinar. So actually, why this topic is very important, because you have listened many times like joint replacement is good. Some of the relatives get the joint replacement done and they might be saying that no, it's bad, it might harm your joints and your life may not be like before. And some say that it has changed my life. Now I'm like walking, running, doing whatever I want. So all these real? So some patients who might be thinking of doing joint replacement and they want to change their lives, so they might be having many doubts in their mind. So depending, so today I'm here to discuss with you what myths you have and what can be done and clearing all your doubts. So I'll start my presentation. So basically, what is ONE? ONE is not a condition, it's not disease, it is actually a process. Okay, where there are inflammatory, it's actually inflammatory process rather than purely wear and tear. All say that this is because of the joint wear and tear. Joint wear and tear along with the inflammatory process is very important. Okay, so because of this inflammatory mediators, the synovial layer, all the cartilage which is supposed to be smooth, but because of this inflammatory trauma, this smooth cartilage gets degenerated, and now because of that there will be roughness in it, and then you have the pain coming. So this is the most common cause of the pain and disability in the geriatric age group. The most important symptom which the patients come for is the pain. Some patients come because they're having some deformity while they're walking, and some patients come because they're having swelling associated with the pain. And arthritis is not only only for the knee joint. Any joint may have this degeneration process, and because the knee joint is the important weight-bearing joint, the knee joint is most commonly involved. And the knee pain is the most important thing in the knee pain is the most important thing in this osteoarthritis. And there is another symptom called the swelling of the knee joint. Okay, the swelling which is called as effusion. And for your information, this is called the inner side of the knee joint, which is called the medial joint line, and this is called the outer line, which is called the lateral joint line. Most of the patients who are having the knee joint, who are having pain, they complain of the pain in this inner side of the knee joint in the initial times. Okay, later it might spread to the entire knee joint. This is important. And the prevalence of the ONE, this is a study which is made in 2020 and 2022 in Indian population, which says that sedentary lifestyle is more in big cities, and because of that, big city people are having much of increased incidence of this osteoarthritis, which is 33%. And also, overweight participants are more in this small cities and towns, which might also cause this increased knee pain. And as you all know, we decide this OA knee depending on the X-rays, and you might have listened to your surgeon saying that you are in grade 2 or 3. So we decide on this classification of Kelvin-Lawrence classification of 1, 2, 3, 4. 1, 2 is mild, and 3, 4 is like moderate and severe. And this is the severe grade 4, where you have a severe loss of joint line, increased osteophyte formation. These are the osteophytes, which is excess bone formed in the knee joint, and the subchondral sclerosis. And so depending on this classification, what is the prevalence of OA-knee in India, which is actually, you will be surprised that most of the population come under grade 1 of the Kelvin-Lawrence, where they don't even know that they're having this starting stage of osteoarthritis. So that is why we say that community education and more of this educating this community and population is very important, so that we can stop this from progressing to grade 3 and grade 4. Okay, so most of the participants are having a sedentary lifestyle, and it's more common in females and in obese patients. So what happens in this? This is a smooth cartilage which has actually damaged because of this inflammatory process, and also which led to this X-ray picture. Here you can see clearly see the deformity of this knee joint. And for example, suppose if a patient, 60 years female patient who's housewife, 83 kgs, now the patient comes to us with a left knee pain since 4 months, having an anterior and medial joint line pain. Now she is having a severe pain while walking and some amount of rest pain. But the range of movement of the knee joint is very good, no other comorbid conditions, and she's visiting the hospital for the first time for this complaint. And the X-ray shows grade 2 to 3 of her knee joint. Now, what will we do? Should we go directly for the injection as the patient is having severe pain and it has been 4 months down the line? No. So there are several other options which we need to start first. We should never go on to we should never jump on to injections or joint replacement surgery. So the management protocols of this osteoarthritis are initially the topical NSAIDs, oral NSAIDs, which actually have a good, strong recommendation of 4-star by the AAOS, and supervised exercises are very important, very, very important. The reduction of the weight, reduction of obesity is very important, and the patient education, like what to do, should we squat, should we not squat, should we do yoga? So all these decisions that do educating the patients regarding this is very, very important. And also there are when the patient has no severe improvement, depending on even after doing all these medicines, even after taking all this conservative treatment, doing lifestyle modifications, if the pain doesn't subside, then we go for the second step, which is the injections intraarticularly. So there are different types of intraarticular injections, and not all injections they work as the same. So there are the common injections are steroid injections, viscose supplements, and PRP injections, which I have heard many times your doctor saying. So the steroid injections are actually, some studies say they are bad. They increases the knee joint arthritis. They fasten the arthritic process. Some say they are good because some patients, like when they come to OP, they say that my pain is like more, and I have a function to attend, I have some temple attend, some function, some festival, like give me a pain-free period for around 20 days, 30 days, so that we can plan our joint replacement later. So then these steroids come into action. They drastically reduce the initial onset of pain, but PRP, they take some time for the action to start, but they have a long-lasting effect. So we combine these injections, PRP with viscose supplements, PRP with corticosteroids, depending upon the need of the patient. Okay, so they are actually an adjuvant to core treatment, but not the mainstay of treatment. Now, suppose if the same patient comes after 8 months, now she's having full range of movement, the same severe pain, but now her stage is now 3 to 4, and she have already taken this non-conservative treatment, injections. Now what to do? Now, actually, there are certain now there is next step. We need to go to the surgeries. So what to be done? There are so usually then this picture you might remember that osteoarthritis knee patients have similar sort of knees. Okay, so this is called as bow knees, where the body weight is now going on to inner side of the knee. The body weight should actually distributed equally in both the knees, and in each knee it should be distributed equally in outer side and inner side. But now the weight bearing is now started in the inner side, so you'll have the knee pain on the inner side of the knee. So now we can correct the axis of the weight bearing simply by doing some osteotomy, which we break the bone, plate the bone, and we correct the position. But it is not always, every patient is not suitable for this because there are certain contraindications, more contraindications. And there's another surgery called unicompartmental knee arthroplasty, where uh, nearly the indications they fall with the HT high tibial osteotomy, where you should have only the inner side knee pain. Outer side should be completely pain free. And at this stage, only you can operate with a unicompartmental knee surgery or a high tibial osteotomy. Why? Because why unicompartmental knee as compared to total knee? Because you have less blood loss, faster relief, and faster rehabilitation. Okay. And the second thing is like, uh, but the problem with this unicompartmental knee is sometime in the near future you might also develop the lateral joint line pain, and you might need a second knee replacement. So what in the total knee replacement will we do? We'll cut this bone edges which are degenerated, and now we balance the soft tissues, we balance the bone cuts, we get a regular aligned knee, and then we place these femoral components. Okay, and now we place this femoral components, which is actually the femur component and the tibial component, which are polyethylene tray, which is called as liner. It is like a shock absorption between both these components. And now this knee, which is actually deformed, now it is straight. Now the body weight falls in a straight line. Total knee replacement, which was discovered in 1968, are now changed a lot, depending even in terms of surgical materials, implants, surgical techniques, everything. And there is one question in the patients like what implant to be chosen. Okay, so what are the options available in the implants wise? See, there's certain many implants depending on like cruciate retaining, cruciate sacrificing, and this deep dish anti stabilizing type of liners. See, all these you just leave to your treating doctors. That will be fine because all some surgeons are more familiar with CR, and some patients need this posture retaining or PCL retaining and PCL sacrificing, depending upon the conditions why you get the knee. It might be degenerative type, or it might be a rheumatic type of knee pain, a rheumatic type of osteoarthritis, which usually needs this posterior sacrificing type of. And now these are the bone cuts in the femur, bone cuts in the tibia. We place the tray, and this is for the patella. So we remove this damaged bone and give it a smooth surface. These are the different types of implants present, which are the cobalt chrome, this is the gold type, and this is the oxenium type. See, which implant is the best? It is nowadays every implant is doing good. Every implant is giving a life of around 20 to 30 years, which is actually good time. Okay, and the most complication, dissatisfaction for the TKR is actually the unmet expectations of the patients. That is more important. The most prevalent minor complications are joint stiffness, inflammation, paresthesias, and infection. The most common major complications are readmission for resurgery. Okay, and the factors affecting decision making of the knee arthroplasty in patients is actually the lack of information, and the from where you're getting this information, that also do affect a lot. So this is a study made depending on how patients think while going on to surgery, and what patients they do really think is so these are many questions asked which are commonly asked by the patients, like, am I a right candidate for TKR? Yes. So actually the first thing is And for example, some person, some random person, just walks into OPD and holds an X-ray, and he says that my patient is, this is the X-ray of my relative, and some other doctor have asked to get a knee replacement surgery. Should I get it or not? See, the first thing I want to say is we don't decide whether a patient should get a TKR, yes or no, depending upon the X-ray. We correlate the patient symptoms with the X-ray, but not we solely depend on the X-ray for a knee replacement. So avoid this silly mistake. Always get the patient examined clearly with an doctor. That is important, because some pain which might be because of the hip, which might be because of the spine, they may mimic as a knee pain. Okay, so when you have a hip pain or a spine pain and you get surgery for a knee pain, so obviously it is a messed up surgery. Okay, so get properly examined by a patient, by a doctor, and think and get it done, like if you're right patient for TCare or not. And are there any options other than TCare? Yes, yes, but there's a limit. It's not like I won't get a surgery done. Show me other options. See, a stage comes where you have to get a knee replacement, like the pain is not subsiding with conservative management. You have done all what you have done, reduced your body weight, you're doing all the physical activity, you have taken the injections, and even the pain doesn't subside. Then there is no need for you to bear the brunt and bear the pain when you have such a good surgery. Okay, so what implants are better? As I've already told, leave the implant part to your orthopedician. Okay, so he decides what implants are there and what will be good for you and what he is familiar with. And because some patients, they say that my relative has got operated with a gold and he is having knee pain. Now, will I get the same implant? No. See, gold, some it depends upon multifactorial. It's not your relative got it done. It's not like will I get the same complaint. Don't compare it with your peers or your relatives. Okay. And another question, which is the post-op pain bad? See, obviously there is one important thing, like if you take a simple painkiller, even it has a side effects like gastritis. Okay, so this big surgery like a total knee replacement, obviously it will have some side effects, but wait, like how much bad your pain is prior to surgery and how much is it post-op. So when will my pain and swelling subside? It's not like the pain and swelling, it's not a simple point like within 1 week your pain should subside, within 2 weeks your swelling should go. No, it is actually a timeline. Every patient, it depends upon the threshold of the patient, how much they bear the pain. Okay, so it depends. Usually it may take around 1 to 2 weeks for the pain and swelling to subside, which it doesn't bother, and later it may slowly improve with time. And how long will it take to walk? See, for a single leg, single knee, if you get it surgery done, usually it takes around 1 day. The next day, as your pain allows, you can start walking, but with an aid like a crutches or anything. Okay, so that is more important. Can I squat and sit cross-legged? See, yes, there are certain questions like, will my life be as the same before? So obviously keep your expectations to be realistic. Do not hope that I can squat and sit. Yes, you can squat and sit, because there are certain implants called high flex knees. They usually allow the knee range of movement to around 125 to 130 degrees. And usually we need, for a good surgery and for a good activity, good lifestyle, we need around 110 to 120 degrees of knee range of motion. So knee range of motion. If you get more than that, it's good. If you get around that, it is an excellent thing. Don't worry about it. And can I squat and sit cross-legged? Yes, you can squat and sit cross-legged, but we don't advise you to do it as a routine. Occasionally, you can. What complications might come? As I've already discussed, so there might be many complications, but the prevalence of these complications are very, very less as compared to the number of surgeries being done. What are you expecting from your surgery? So we'll discuss this in detail in the next slides. how long is the physiotherapy needed? So physiotherapy usually is not like 1 month or 1.5 months. You can actually, you need for initial 3 to 4 weeks, you need an aided physiotherapy, and later you can all do it all by yourself. Okay. And will I get the same result as my relatives got with this surgery? So that is a very, very important question. Not compare it with your other relatives. They might be a different X-ray. They might be have a different clinical presentation. They might be a different pain threshold. They might have a certain other demands which you don't have. Okay, so what are the causes of patient dissatisfaction in this knee replacement? The residual pain. See, obviously you can't assure 100% of pain relief because it is a surgery, and obviously they might have 5 to 10% of the pain, but you're having before surgery, you're having a 90% of pain, which is now 10% of pain, which is a good thing. And don't think that 100% of pain will there will be pain relief and I'll be like 30 to 40 years youth. No, it doesn't happen. Okay, and don't expectations are high, and on the limitation of function and psychological issues, need for resurgery in comparison with the pace are the causes. So the other causes also, which might be because of inflammatory conditions, crystal-induced arthritis, and other causes of the pain like fibromyalgia, disc, radiculopathy, spine injuries. Okay, and other causes of pain in knee, pre or post-op, are very important. Other causes of knee which should be evaluated by an orthopedician. And it also depends upon types of arthritis. If you're having a degenerative arthritis, you'll have good relief as compared to a rheumatoid type of arthritis. And age of the patient, because younger ages like 60, 65 ages, they do have a good capacity to bear the pain and also get good rehabilitation. And other patients like more than 70 years, they have an limited function, usually because of the age. Because yes, we have done the surgery for the knee, but we don't expect every other part to be that much good as such as that of the knee joint. Okay, and the socioeconomic conditions, the comorbid conditions like any cardiac problem, any previous surgeries also, and the family support is also very important. And this is a very good graph which you need to understand. Like, so for example, this is a very good health patient. And if the patient, when should you get the surgery is like, suppose if the patient is having around 40 to 50% of pain only, and you have done a surgery for the patient, then what happens is obviously the patient will have a 90% relief of the pain, and only you get a by doing this surgery, you will get an achievement of 40 to 50% pain only. So that person might have a negative perception that there is no much great relief with the surgery. But ask it, but now compare it with the pain who is with the person who is having 80%, 90% of pain. Now he will show a drastic amount of positive perception. That is important. The stage where you get the knee replacement also done is also important. Okay, some patients ask that we walk 3 kilometers a day, but we have to be having pain while rest. Can I get a knee replacement? No. When you're walking 3 kilometers a day, why do you want a knee replacement? When you can't even stand for 10 minutes and when you can't even do daily activities, then there comes the role of this knee replacement. Okay, the patients obtained information about TK from different sources like televisions, media, other relatives. That is not good. Get a professional information. That is very important. And the patient's previous experiences, like any other non-orthopedic procedures, is also very important. And the financial issues are also very important. Okay, and the participants has good expectation about improving the surgery. Okay, and a number of fears were also identified: fear of lengthy recovery, fear of complications, and anesthesia. So these all topics I've discussed now. The relationship between patient and the physicians often discussed and included issues of communication. So always communicate with your doctor, sit with him and ask what you are going to expect from this knee joint. Do not compare it with your relatives or any other family members and say that these are expecting this much result. Will I get the same? Or these are having bad result. Will I also suffer these complaints? Okay. So thank you for this.
Thank you very much, Dr. Deepak, for this presentation. Thank you. We'll wait for you to stop your screen so we can just take some questions. Yeah.
Yes, sir.
Doctor, can I take some questions?
Yes, sir.
The
Please.
first question which I've got from SMS is from an anonymous attendee. Is what is the cost of TKR, and is it better to go in for a conventional surgery or a robotic surgery?
Yes, the first thing is like cost. Always the cost depends upon in the cities it will be different thing. It will like cost you around 2 lakhs, and depends. It also depends upon if you're getting a conventional thing or a robotic thing. And yes, which conventional or robotic is better? This is actually a debate which many studies have say. See, conventional and robotic in the long term, they have the similar type of results. Okay, that is what. But in the initial days, the robotic have a limited. Obviously, they have a limited blood loss, faster recovery, faster rehabilitation. All these are good with robotic. And if you have a chance to get a robotic and you're affordable, go with robotic.
All right. Thank you, doctor. We have a question from Mr. A.K. Chopra, who's 74. Doctor has advised him TKR, but there's a deformity in the red leg, and sometimes there's severe pain, but most of the time there is no pain. He says he can walk 2 to 3 kilometers, do yoga, cycling, stretching, etc. He wants to know whether he can go in for a knee replacement. But before you answer that, doctor, a word to all our attendees today and those who are going to be watching it later. While we have invited Dr. Deepak here for this session, very, very personal views are always a little tricky. These are sessions like these are advisory in nature. There's nothing to beat a clinical examination and a personalized advisory session with an orthopedic surgeon, which you must take, is my suggestion. So, having said that, doctor, can you advise Mr.
Yeah, sure.
74?
So as we have already discussed and have already discussed the same point many times in this webinar, like the first thing is like what are you expecting more from your lifestyle? So you're walking 2 to 3 kilometers a day, which is actually very good thing, right? And what more do you want? And you have the knee pain. Obviously, see the first thing is like when you're doing such a good activity like 2 to 3 kilometers a day, and you're doing always all this, and obviously after surgery also there might be some knee pain. So as I've already told, there might be 5 to 10% of knee pain because it is a surgery. Even a simple NSAID like painkiller like paracetamol also have some side effects of gastritis. Okay, so but this is a surgery, and obviously there will be minor pain of 5 to 10%, and some patients may even say it is a 15% of pain they do have after surgery. So you are having such a good ability and occasional pain, we usually do not advise our patients to go for TKR. Leave what the X-ray says, but what the important thing is we examine the patient clinically. Clinical importance is main, because if you're having only 30 to 40% of pain and we are giving you 10% of pain, then what more will you achieve from that? How much satisfied will you be after the surgery? That is important.
Right. Doctor, there is a question from Shamala Ravi, and she wants to know what are the salient features of smart knee technology?
Sorry?
What are the salient features of smart knee technology?
So this is actually the most important thing is they have a good recovery period. They have a good recovery period, and also it is something like we customize the implants. We customize. See, all these implants which we operate daily is actually like we have like certain sizes A, size B, size C, and we take the patient and while during the intra-op surgery we examine the patient what size knee will fit, knee implant will fit to the knee. Okay, so there might be minor variations in the patient fit and the implant size, but what happens in this knee is we previously before the surgery we get the sizes of the knee when we customize all these implants depending upon the particular patient. So that is actually a good thing. You will have good post-op pain relief also.
Doctor, there's another question that has been asked. I keep hearing a lot of my friends who are going in for total knee replacement and various other joint replacement surgeries. Um, Before I get to the point of having to do this surgery, can I do a annual checkup with uh, with somebody, and what should be the checkup be like?
So the first thing is for the knee as part for the knee health, it is nothing more blood tests are needed. With a simple X-ray, you can just know what your knee status is. No need to get other severe more blood tests and X-ray scan, anything of like that. The more important thing is an X-ray. But always like correlate this X-ray with your knee pain. Don't just get panic or just anxious on seeing the X-ray. Like my knee joint is not like normal as shown in some Google pictures or something like that. Always think about what like clinical symptoms are you having. That is important.
All right. Um, Doctor, there's another question from an anonymous attendee. But first, I'll just take this. This is from Jambuthan R, who is a male aged 75. His question is, can you tell me what is regenerative arthritis?
Yes. So actually, this is degenerative arthritis, and also there are some things called as because this is the degenerative. Matlab, the cartilage which is present inside the knee joint is now getting wear and tear. Okay, and also there are certain things like we get this PRP, the platelet-rich plasma. We just centrifuge it from your own blood. Okay, we centrifuge this plasma from your own blood, and we get the concentrated platelet rich plasma, and these platelets do have a good amount of growth factors. So these growth factors are actually they work they help in giving you much amount of pain relief and also long term results. That is important. And also these growth factors reduce inflammatory cascade. This is one thing. And as coming on to how much relief you will get, it depends upon how at what stage you are. In second and third stage, any like regenerative therapies will work good. But in stage four, already the cartilage is damaged. Now you can't get the new cartilage even with these regenerative therapies. So it's not that worthy in stage four. In two and three, yes, it is a good thing which you can go, but don't expect like you will get immediate pain relief when you get this injection PRP or regenerative therapy. It will take some time. It will take around 1 month around. Okay.
Right. Doctor, this is a question from an anonymous attendee. Uh, Says, Doctor, we hear of a lot of orthopedic surgeons taking on joint replacement, specifically total TKR surgeries, and they do many surgeries on a single day. Are these safe?
See, the first thing is yes, it's a very good question. Like, see, it's not like we every surgeon does these many surgeries in a day. Usually, on an average, a surgery takes around this knee replacement surgery takes around 1 to 1.5 hours, and it also reduces in experienced hands. So there are many surgeons who have done around 10,000 knee replacement surgeries in their lifetime. So it's not like and also not a single surgeon does all the knee replacement surgeries. They usually it is a multi-specialty hospital, and you'll have 3 to 4 orthopedic surgeons who are experienced in this knee replacement surgeries, and also they do these surgeries. Okay, so it's not like a single surgeon does all the surgeries, all the 15 surgeries in a single day. No, that doesn't happen. Don't worry about that.
All right. Thank you, Doctor. And one last question, which is there again. These questions are coming to me via SMS more today. Is what is the success rate of knee replacement and other joint replacement surgery?
Yes. So initially, like even see, I in my training time also, my professor had had a photo of his first surgery which he done around 40 years back. Now even the patient is doing good. Even 40 years back, the surgery was done, and even now the patient is doing good, and he has a photo with his first patient. So don't worry, even at that times also the surgery was good. And even now, these days the surgery, because there have been many other good implants, good robotic surgeries, all these yeah, customized implants, and the surgery now, these success rate has been increased around 90%, more than 90%. The surgery rate,
Great.
more than 90%.
Thank you very much, Doctor, for your time today. For all of you over here, I know we've got a special time. We never have done this at 4 o'clock, but he has two surgeries at 5 p.m. And, as all of you know, we would never like to take a doctor away from his his or her patients. But we will be back next week again at 5 p.m. at a regular time of 5 p.m. So do join us there. Doctor, one last question that I want to ask you. You are among the first doctors whom we have from a tier 2 town, or a city which is near Visakhapatnam. How is and we have a host of, while our attendees, most of them are from the main cities, the major cities, but there are people who are from smaller towns as well. According to you, how is the healthcare facility, and especially for things like joint replacement in tier 2 India?
Yes. There are now, initially, even in tier 2 cities, there used to be a very less medical facilities, but it has been like many years, very, very good multi-specialty hospitals has been established over there. And even government has also, even now, there are many schemes like the National Health Mission, and also we have Arugshri in our Andhra Pradesh. Okay, so even there we are getting many surgeries which are done at very low cost also, and there is a good amount of healthcare facilities which are now improved even in government setup and also in private setup. Right. And also initially there used to be something called as, this is a peripheral setting. So these are all the peripheral areas. We can all do these knee replacement surgeries only in a major city, a metropolitan city. So initially that used to be talk, because in peripheral settings we don't have that good operation theaters, that good infection control management. But even now in our hospitals also there are several good operation theaters where we also follow all the infection protocols, and also we have the laminar flow operation theaters, which is actually very, very good thing in even in tier 2 cities.
Thank you, Dr. Deepak, for taking this session. Your session was, very detailed, and in fact answered several questions. As always, the edited video will be there on the Seniors Today website on Monday evening rather, and you can see it along with the takeaways, which are written by a medical practitioner. So do have a look at it. And we will be back once again next week at 5 p.m. for another session of Health Live at Seniors Today. Once again, thank you, Dr. Deepak.
Thank you so much for having me. Thank you so much. I feel privileged. Thank you.
Subscribe now and press the bell icon. Never miss an update.